Thanks for staying with us. Now, the recent COVID-19 cases in South Africa are clear signs of the fifth wave. That's according to Professor Tulio de Oliveira of KZN Research, Innovation and Sequencing Platform. He says the positivity ratio is as high as the previous 4 waves, but present harsh restrictions are not necessary as the country needs full economic activity. He joins me now from Cape Town. Thank you so much for your time, Prof. We do appreciate it. I think anybody who's tracking the COVID-19 numbers is starting to panic because we've seen numbers nearing 10,000 per day. Our positivity rate has shot up. Does this indicate that we have entered our fifth wave?
Yeah, good evening, and first, happy Mother's Day to you and everyone. Yeah, so it's no need to panic. Yeah, we are in a very different phase of the pandemic. Yeah. And we are tracking the numbers very, very close, both the number of infections, the positivity rate, but more important, the real numbers to really follow now is the number of vaccinations and also number of hospitalizations and deaths. Yeah. So most of the metrics, yeah, if you go especially for test positivity rate, yeah, it really suggests that South Africa is in the middle of the fifth wave. But what we are seeing now, it may be quite similar as the previous wave. Is a less deadly wave. And that's why it's so important to first recognize what's happening, yeah, so people can take extra care and people can get vaccinated or boosted, and also start advancing both of the science, but also keeping eye how our hospitals are coping, which at the moment they are coping very well.
I want us to speak about what variants or which variants, subvariants of Omicron is driving our fifth wave, and if it's any different to what we've seen previously. Are there any different symptoms that people are experiencing this time around?
Okay, so what we are finding is not only in South Africa, but happened around a month ago in Europe and it's happening as we speak in the United States of America, is that was a slightly change on the way that waves come. So we are not seeing a new variant, so it's still Omicron, but what they have seen in the United States, in the European Union, and Europe, and now in South Africa, what we call lineages of Omicron. So at the moment, the two ones that are dominating the South African infections, BA4 and BA5, and very high, close to 100% of the genomes that we sequence are this BA4 and BA5. And why that? Why Omicron, a different lineage start to dominate? Yeah, and the answer is because this BA4 and BA5, it can break through previous infections, yeah, previous immunity of our first big wave of Omicron. So what it means, it can go back to the population and reinfect the population, especially the ones that haven't been vaccinated or haven't received recently a booster.
Could we maybe speak about vaccine numbers and how that seems to be a concern, where government has been at pains to get people to get vaccinated and also to get their booster jab? How crucial is it? And the reason why I ask this, and in the context I ask this, is because, Prof, the reality is many South Africans, and I don't even think just in South Africa, people almost feel as though COVID is over, there's nothing to worry about, infection rates very low, people aren't getting as severely sick or aren't dying as previously. But how important is it for people to still go and get vaccinated if they haven't done so?
It is extremely important because that's the main reason the main reason why COVID is going to go away is going to be through population immunity. Yeah, a lot of people have assumed, especially with the very big waves that happen in South Africa, that immunity just from previous infections. The great majority of people in South Africa have been infected, either symptomatic or symptomatic, would protect from other waves of infections. Unfortunately, that's not true, and that was some very, very advanced scientific results that came last week from a colleague of us from University of KwaZulu-Natal, Professor Alex Sigal, that showed that just previous infection, would not, after 3 months infections, you would have lower level antibodies, which allow one to be reinfected. And the problem is not just people dying, which is very sad, especially today, like as we celebrate Mother's Day, many people have lost family members in the last few years, but it's also the problem of long COVID. So we really want that as people to protect themselves. And what we find, even especially people that have been previously infected, what we found is that follow that with a vaccination will create very high level antibodies. And that's the kind of ways that we're going to really get out of this pandemic.
Let's move over to COVID regulations and the fear that there might be some kind of harsher restrictions or regulations, even though this might be slightly difficult for the government given that the state of national disaster has been done away with. But is there a need for any stricter or harsher regulations that we've seen previously because our numbers are increasing so much over the last couple of days?
No, at the moment, there is no reason to even think about harsher regulation. And that's because we learned a lot during the pandemic. The crucial numbers to get a look is not going to be number of infections or positivity rate. It's going to be the number of hospitalizations, and the carrying capacity of the hospital. Given that this wave is coming after a very low level wave, so we have a lot of expert capacity in the hospital. And at the moment, we only have 300 people in ICU, so there's no reasons to increase restrictions.
I want to get your perspective, Professor, on the new regulations, or if I can call them amended regulations under the National Health Act, where there's been much criticism that the Department of Health left it for the very last minute, and the issue of mask wearing. Many are saying, what's the point if you don't have to wear it outdoors? Why should you wear it indoors? Do you think the current regulations as they stand deal with the issue of COVID-19 and assist in terms of COVID-19, and should the department need to amend them, they can? But as they currently are, what is your perspective on that?
So it's a very difficult balancing act, to try to balance both the health, the economy, and the effect of masks. So what I think that we have decreased a lot our use of mask, and the necessity to use masks, for example, as you highlight, is not needed to wear outside. But one thing that we know, especially as we come to the winter months and with cold, where people stay closed inside with low airflow, that may still be important. So, for example, in our labs and our office, we still use masks inside, but it is because we think we work with the virus, so we really want to avoid outbreaks. But at the moment, it's as I mentioned, it's a difficult position that not only the government is, but the whole world, because the whole public, everyone is very tired of this pandemic. Everyone wants to go away. And what one wants to do is to bring the minimum regulations that we can, which in South Africa is very low, but is still try to avoid very large outbreaks.
And what is your perspective on gatherings? Because there's also been criticism around the fact that not as many people can still not gather, and if they do, they need to have proof of vaccination or a negative PCR test.
Yeah. For me, it's quite simple. Anything that can encourage vaccination would be very good. And I think that gathering is much better if it's open air. Than closed space. And what many countries are doing in the world is that if people are vaccinated, you don't have any carrying capacity of gathering. So, for example, South Africa normally has very large, in my field, international conference. That at the moment we are not running. We have this very large international convention centers. And would be very good if one almost could exchange. So if you have a large group of people vaccinated, that you could use high capacity of the venues. But again, I am just a scientist, and what I know is that in these regulations, it go many different aspects that the government have to deal. We have to deal with the health, with the scientists, with the public, with the economy. So I honestly think that in South Africa, we have been trying. We have been trying a lot. A lot of times we make mistakes, but we think that's better to make a mistake, but be quite conservative.
And just lastly, Prof, so there's nothing new that we need to be worried about. There's no new symptom from the lineages of Omicron. And even though you're saying we probably definitely in our fifth wave, just get vaccinated. Is that the message? And don't panic.
I think first panic doesn't help, especially for proper response. The second is that vaccination is our best weapon. Third, try to avoid infection is also very useful, because as we know, it's not just about the symptoms of COVID, extreme symptoms such as a lack of breaths that may end up your hospitalization, but we are having a big problem of long COVID around the world. So this week, the United Kingdom estimate that over 2 million people in the United Kingdom can almost not go back to work from long COVID, that's from suffering really severely tiring and a lot of time then affecting mental health. So I still think that would be very, very wise to us to be quite careful, especially now as the weather gets cold, and try to avoid infection, try to avoid unnecessary gatherings, especially when you have the option to do, by still using mask in a closed space. And more important, we have more than enough vaccines in the country. It would be really good if we could increase the vaccination, because more than ever, then we can go back to normal life.
And it's about tackling the issue of this misinformation and fake news around these vaccines. But we thank you for your work, and we thank you for always making yourself available to explain all of this, because it has been very complicated. Thank you so much for your time. That is Professor Tulio de Oliveira.